Hi everyone, my project is on vocal fold, paresis, and paralysis. Here's some basic terms that I think we should all know about when talking about this type of disorder. Damage to the vocal folds leads to damage to the vagus nerve, also known as cranial nerve 10, which affects the superior laryngeal nerves and the recurrent laryngeal nerves. Here would be the external and internal superior laryngeal nerves, and here would be the left and right recurrent laryngeal nerves on the vagus nerve. And damage to these areas can result in problems with opening and closing the vocal folds, as well as tensing and relaxing the vocal folds, therefore impacting overall vocal quality and function, as well as impacting the swallowing mechanism. As we all know, vocal fold paralysis and paresis can also lead to higher risk of aspiration. Vocal fold paresis involves partial damage to the specific nerve, resulting in weakness of the recurrent laryngeal nerve, superior laryngeal nerve, or both. It's more common than vocal fold paralysis, which is when there is a complete damage of the nerve, resulting in no movement of the recurrent laryngeal nerve, superior laryngeal nerve, or both. Damage may present as dysphonia, loss of upper register of voice, hoarseness, breathiness, throat pain, choking episodes, decreased vocal stamina, and so on. It may also contribute to muscle tension dysphonia and development of benign vocal fold lesions such as vocal nodules and cysts. And paralysis and paresis may be classified as unilateral or bilateral. There's many causes associated with vocal fold paralysis and paresis, such as iatrogenic trauma, which involves damage that occurs during surgery, and non-iatrogenic trauma, which could be tumor infiltrations and compressions. There's also neurological diseases that can cause paralysis and paresis. Infection, collagen vascular diseases can also cause damage to the vocal folds, as well as idiopathic causes, which are causes that are unknown. In order to assess vocal fold damage, you would have to obtain medical history and perform a physical examination. Physical examination would be performed by the laryngologist, who would assess the head and neck in its entirety. And they would assess it via mirror exams, laryngoscopy, and also have the patient perform multiple phonatory tasks. Instrumental assessments used to differentially diagnose vocal fold paresis from paralysis could include strobo-video-laryngoscopy, laryngeal electromyography, as well as functional endoscopic evaluation of sensory thresholds. These can also be performed by the SOPs. However, SOPs cannot diagnose voice disorders. Voice disorders can only be diagnosed by the laryngologist. Treatments such as voice therapy, which is within the SLP scope, can be used on patients with dysphonia to improve vocal function and quality. SLPs can counsel patients about phonation abnormalities associated with it and can educate the patient on ways to modify voice and improve vocal hygiene. Treatment can include head and neck muscle relaxation exercises, as well as expiratory, inspiratory muscle strength training, Lee Silverman voice therapy, voice adduction exercises, and so on. There's also surgical therapy, which includes medialization of the vocal folds and reinnervation of the vocal folds. There's laryngeal pacing or functional electrical stimulation, which uses electrodes to stimulate laryngeal muscles for adequate vocal fold adduction and abduction. And lastly, there's been a lot of research on gene therapy. I'm sorry, I made a mistake. There's been some research on gene therapy, but not much has been done. And it's believed that paralysis can be regenerated and restored via stem cell therapy. Thank you.